Hi, I'm your host David, and welcome to another episode of Debu Living. We're happy to have with us Dr. Peter Johnston, an experienced chiropractor and an expert in integrative health practices. Welcome to the show, Dr. Johnston.
Thanks for having me, David.
Well, it's nice to have you with us. So to start us off, can you tell us a little bit more about your background? What made you interested in being a chiropractor?
Yeah, that's a great question. So do you have time for a longer answer? Okay,
Yes,
great.
sure we do.
So when I was 8 years old, I grew something like 6 inches over the course of a summer. And the nature of growing 6 inches over a summer is like, that's maybe how much one should grow in a year. So just like incredible growth spurts. And one morning I wake up and I can't move my arms or my legs because I'm cramping so badly because of like the growth spurt pain that I was having. And my mom picked me up and carried me into the office of this manual therapist. And an hour and a half later, I walked out. And I was like, oh, this is pretty cool. Fast forward to high school. After years of being a clumsy kid with ADHD, being very athletic, having all of the injuries, and seeing this professional like pretty much as often as I needed, which was an awful lot, I didn't really know what I wanted to be when I grew up. Like I had this strong sense that choosing the wrong thing would devastate me. And what I did was I talked to this person who had helped me out when I was 8, and I asked them what they thought I should do. And they said, I don't know where you're going. I don't know where you're going to end up, but you should think about maybe going into massage therapy, like as a place to figure out where you want to go. And at the time, I thought that was really weird advice to give a 17-year-old. And I was like, okay, well, like I probably won't do that, but I'll think about it. Like, why not? And before it came time for me to make the decision, like put in my university applications, she passed away. And before she had passed away, she let my family know that I was to have her things, like any of the tools of her trade, that if I wanted them, I was to have them. And I took that as a very strong sign. And I was like, okay, cool, I'll go to massage therapy school. So I did massage therapy school. I practiced for 2 years, got really frustrated by the limitations of that profession. Pursued a degree in kinesiology at University of Toronto, applied to all of the next level post-secondary education that I could, tried to get into med school really hard for 3 years. And at the end of those 3 years, I kind of felt like I had a choice. Like I could either travel internationally or I could stay in Toronto. And so I did a bit of soul searching to figure out what was really important to me. And the part of my job at that point that I loved the most was, so you have this client in front of you, and they're hurting, and they have a kind of structural hurt that's just going to take somewhere between 1 month and 6 months to pass. There's a really cool puzzle there where, with the capacity that this person has, can you give them the tools to navigate that 1 to 6 months as comfortably as possible, as meaningfully as possible? Like, can you help this grandmother pick up their grandchild so they can continue to care for them? Can you teach this athlete to perform a movement slightly differently so they can still make a run at their international level sporting event? Like, that puzzle is so cool and so interesting to me. And I recognize that as a medical doctor, I wouldn't get a chance to really dive into that piece of the puzzle. Like, it's a bit more of a diagnostic and prescriptive practice. And so there for me, it was like, oh, I really want to do this. And that meant just a higher level of education in sort of non-surgical, non-medicinal orthopedic medicine. And that those in Ontario, your options are kind of like physiotherapy or chiropractic. I applied to both. Chiropractic was available in the city of Toronto. I, at the time, had someone who I was very much in love with, and the thought of moving to another city was a no-go. So chiropractic it was.
So that's a very interesting journey.
Yeah.
You can tell from your experience. In your opinion, why does chiropractic care matter?
So I think that one of the most challenging puzzles to solve in healthcare today are the complex problems that are suffered by an aging population. So we're talking knee and hip osteoarthritis. We're talking back pain, which is the 4th leading cause of disability in North America. We're talking chronic pain, which impacts somewhere in the area of 1/5 of people at any given time. all of these problems are really poorly solved by the easiest interventions to give. So these problems are very poorly solved, unfortunately. Like, they don't necessarily show up well on imaging. They aren't all requiring of surgical intervention. They don't all respond to medications very well as a solo therapy. And so the role of like chiropractors and physiotherapists and kind of the rest of the extended healthcare team is to step into the spaces that are too complex for single molecule solutions, where you have like a whole person who has a whole life, figuring out what skills and tools these people need to make their functional handicap be less disabling, and provide therapies that help people to kind of get from where they are and in a place where they're like somewhat stuck and somewhat disabled to where they want to be living the kind of life that they want to live.
Well, that's great. What advice would you give athletes and fitness enthusiasts?
I have a couple pieces of advice that I'd like to give athletes and fitness enthusiasts. First, keep up the good work. You're doing great. Movement is probably the best medicine that we currently have available. It's really good for you. It has a bunch of downstream effects that are really just lovely. So if you are being physically active, keep it up. You're on the right track. Take pain around your joints seriously. So when I say joints, I mean like everything from the small joints of your fingers, elbows, knees, shoulders, spine, any pain that you have around your joint. So the way I like to think about it is that muscles and bones heal really quickly. Joints, tendons, and tendons are always around joints, heal relatively slowly. And so those structures that heal really slowly tend to be the first to pop up as things that will disable or make athletes less able to do their sport. So treating those early signals of discomfort, soreness, achiness, difficulty moving first thing in the morning as a sign that maybe you should either decrease the amount of physical activity that you're doing slightly so that your body can accommodate for that change. So like rest days, rest weeks, up to rest months are great for athletes and really minimally impede their performance over a long scale. Like, so over the course of a year, an athlete can take up to 2 non-consecutive months off and perform just as well as an athlete who's taken no time off. So rest isn't as bad as people are worried that it's going to be. The time that you take to make sure that your joints and the areas around your joints are doing well can either make sure that you can push harder when you return to the physical activity, or it can give you an opportunity to see a professional like me, like a physiotherapist, like someone who's competent in understanding movement, understanding the nature of your sport, and giving you tools to help work around it, to make the movement patterns that you're engaging in that put extra stress on these joints cleaner, easier, more tolerable, and let you get back to higher performance a little faster.
Well, that's nice advice. What techniques, I mean, a lot of people might want to know this, what techniques do you use usually in your treatment process?
Yeah, that's a great question. So I'm going to tell this like it's a story because I think I think it's fun. So when I started as a massage therapist, I learned a particular style of like a myofascial release therapy. And that seems to me to be really good at addressing problems of muscles and some of the soft tissues that surround them. As a chiropractor, I got to learn how to do joint manipulation therapy and became really proficient at mobilization therapy. So that's the thing that if you've watched TikTok, that's sort of the procedure that you've seen done a bunch of times. I will say that there are things that you will see on the internet that I won't do as a therapy, because I think from a dose response relationship perspective, they're a little extreme for 99% of patients who would come into my office. But that tool set is definitely there. I do acupuncture, and it's acupuncture in more of a Western style thinking. So not so much being concerned about your chi, more being concerned about, hey, how are the muscles and the nerves that go to them working, and can we get the area to function a little bit better with some combination of needles and electricity? There's a bunch of assisted soft tissue therapies. So if you're familiar with Graston or instrument-assisted soft tissue therapy, that can be good for some superficial type injuries. I use laser therapy in my practice for folks who can't tolerate the more intensive therapies. And then rehab and sort of coaching around rehab is a very important part of the tool set. And I think this is something that, like, you can talk about the tool set that you have. I think the most important tool set that I have is the tool set of being a diagnostician. So it's like, can I figure out what's going on with you? Can I explain it to you in a way that makes sense to you in your body, that like matches your embodied experience? Can I give you advice that you're actually going to follow? Because if you don't follow the advice, it's not very good advice.
Right.
And can we, like, together come up with a plan that fits into your life that helps you move from point A to point B? Like, all of those tools are ways to do that, but I think the process itself of like figuring out what the problem is, figuring out what we are going to do about it, and then making a plan and adjusting that plan as we move forward is the thing that really works. All of the other therapies that we include there are things that might make it happen a little faster, might make it happen a little bit more comfortably, but it's the structure that makes it work.
It's great advice. A lot of people might sometimes be adamant about pursuing chiropractic treatment. In your opinion, like, what are some of the potential risks, or if there are any potential risks associated with chiropractic treatment that you can address, or what would you tell them? Like, should they pursue chiropractic treatment in the first place, or what advice would you give them if they're like a little bit afraid of doing it?
Yeah, great question. So I think part of the way that I understand this is that any therapy that is powerful enough to induce an effect is powerful enough to have side effects. It's the downside of medicine. And like, when I say medicine, I mean evidence-based healthcare writ large. Overall, chiropractic care is safe and effective and is well tolerated by most of the people who receive it. When you look at the body of literature that chiropractic care has, in almost all of the studies, people do suffer some amount of side effects, and most of those side effects are like next day muscle soreness, next day discomfort from therapy. And that's what I think that most people who are getting care can expect. Most of the people who come into my office, if we're treating them for low back pain, odds are the structural, like the kind of functional, the milieu that created their back pain has existed for a while before their back pain started. So for as long as they've had back pain, certainly, and probably for some length of time before they started to have back pain, they had some sort of way that they were holding their spine, which wasn't as good as it could be. And so when we go into this area where there is spine pain and there hasn't been normal movement, all of the tissues that would support normal movement are atrophied, like they haven't been doing their job for long enough. And we go in there and we restore normal movement to the spine, and that's really great because it gives those tissues that are atrophied an opportunity to get reconditioned. And then we give you exercises that give you further opportunity to get reconditioned. But just like it is really painful for you to go to the gym for the first time in 3 months, it can be somewhat uncomfortable for you to have a spine that goes from not moving well to moving well really quickly. And so there's sort of a natural curve to go over. There are some people who, because of their age, because of their health history, because of their background, might have higher risk for any number of different side effects. And that's sort of where, like, being a judicious healthcare professional, like having that discernment of being like, you know, there's a risk profile here. The thing that I will tell you with some amount of certainty is that every chiropractor who is worth their salt is going to have a conversation with you about the risks and benefits of the therapy that they're going to provide. They're going to make sure that you're well informed about what could happen and what risks are like reasonable for you to think might happen to you and what risks are unreasonable. And then they're going to have a conversation with you. So for example, with low back pain, very frequently that pain can be caused by discs. One of the things that we know from like the literature and from population experience is that some disc pain can get worse with spinal manipulation therapy. It can progress. There is some amount of this where it might be the straw that broke the camel's back. It might be something different, but like the forces that move through your spine with the manipulation are somewhere in the force category of like sneezing or bending over to pick up, say, 2 20-pound bags of groceries. So not insignificant, but not crazy, certainly within the normal limits of what a human being goes through on the day-to-day. And so when I have a patient who has a disc-like presentation, who maybe has a radiculopathy or like a pinching of a nerve that goes down their back, I'm going to have a conversation with them about that being a side effect. I'm going to talk to them about the things that I can do to mitigate those risks. I'm going to talk to them about therapeutic alternatives, and I can tell them what, in my experience, is likely to happen for a patient like that. And then we're making a decision together, right? Like it's
not enforced.
It's informed.
Yes.
Yeah. Yeah, no, but it's not enforced. And I'm a clinician first. Like, my job is to help you. I have this big old tool set. Like, I would love to go through it with you and tell you what I think will work best and what I think won't work best. But I've worked with patients who are like, I kind of don't want you to touch me. I just want rehab exercises. I want to handle this on my own. And that's a high five. Let's talk about it. Right? Like, it's patient-centered care means that you're delivering care to people in a way that makes sense to them, in a way that they can internalize. And I think, like, taking care of someone's kind of a sacred trust, right? Like, someone's giving you their body, they're bringing you something that's like really, really vulnerable, and they're asking you to attend to them in a way that makes them better. And so part of attending to that trust is really paying attention to the person who's in front of me and trying to make sure that they're getting the care that works for them. And whether it's I feel afraid, or I have a parent who's had a bad experience with this, or I have a preference for this thing because I have the experience that this has worked in my past. Like, I'm here for you. This isn't really about me at all. So I'm kind of happy to use the care that makes the most sense to everyone in the room.
That's great. Well, thank you so much, Dr. Johnston, for telling us all this sort of information, and we truly appreciate your time and the tidbits of information you provided. Is there anything would you like to add at the end of this interview? Anything about like your personal clinic that you would like to share with people, or anything?
Yeah, so I have a clinic that's downtown Toronto. I'm at 2 Carlton. You can reach me at www.drpeterjohnston.com. I am on Instagram as well. I write a bunch of blogs, and I try to provide as much like patient-centered, sort of mindfulness-informed ways to interact with your body and your athletic practice, and hopefully get better at doing the thing that you want to do.
Yeah, thank you so much for your time.
My pleasure. Thanks for having me.
Thank you. For all our viewers, stay tuned to another episode of Debu Living.